State leaders say an audit into a UPMC insurance program revealed that failures to update data and delays in reporting changes led to the state overpaying thousands of dollars. The Auditor General's office explained how this situation happened and what needs to be done to ensure it doesn't happen again. A performance audit into UPMC's Community Health Choices insurance program found a loophole that cost taxpayers more than $350,000. The Pennsylvania Auditor General's office announced Monday UPMC didn't adequately perform all its required assessments.
UPMC either didn't perform the required assessments to see if people were still eligible for care, or when they performed the assessments, they were done too late.
Gordon Denlinger, Deputy Auditor General for Audits, said UPMC also didn't notify the State Department of Human Services of eligibility status changes in a timely manner once they became aware.
This is important because DHS uses data from these assessments as a key component in determining how much UPMC gets paid to cover the care provided. We found instances where DHS paid UPMC for people enrolled in the CHC program who were deceased, went to jail, or were no longer eligible for the program.
He said in the 66 cases they looked at, DHS made incorrect payments for 8 participants and overpaid UPMC by about $357,000 in 2022. The state wasn't able to recover about $121,000 because of restrictions in the contract with UPMC. The Community Health Choices program of UPMC Health Plan is designed for people who receive long-term supports through Medicare and Medicaid. It served 156,000 people in 2022. The auditors made strong suggestions to UPMC, including to make sure DHS is informed of status changes on a weekly basis as required.
UPMC needs to make sure there is greater accountability in its management structure to make sure the required assessments are happening timely and on a regular basis.
He said UPMC has agreed to most of the recommendations. The auditors have some advice for DHS as well.
DHS can make sure that Pennsylvanians get back all the money owed to them when they overpay for services by changing the contract language to close this loophole.
A UPMC health plan spokesperson said in part they had implemented improvements before the start of the audit and made additional modifications based on the auditor's recommendations. They also said we continue to support a strong Medicaid program through our partnership with DHS and operate numerous program integrity efforts beyond what is discussed in the audit.